Hello everybody, my name is Bradley Cooper and I'm one of the officers of the Bucks County Libertarian Party. And all across this country, protests have been popping up in different towns, cities, counties, states, because people are irritated, annoyed, and ticked off at these continued lockdowns that are still enacted till today, and some states that are easing restrictions are not easing enough restrictions to allow majority of the state to get back to work. Only certain businesses and industries can come back to work. Now, if you look at a state like Michigan, Vermont, Delaware, Pennsylvania, New Jersey, New York, for instance, they're ran by Democratic governors. They are easing restrictions very minimally, and only, as I said, certain industries, businesses, or certain areas of the state can open up. Certain businesses cannot open up, or there's very strong regulations for some businesses that are opening up, have to adhere to, and a lot of people can't still get back to work. Then you got states like Tennessee, South Dakota, South Carolina, Ohio, Georgia, Florida, for instance, ran by Republican governors. They have eased a lot of restrictions and they're getting back to somewhat normalcy. Now, why are these Democratic governors being so stingy, not allowing a lot of people to get back to work more than what they're allowing now? Why aren't they easing more restrictions? Why are we just taking what they're saying and accepting it and not questioning them, not raising an eyebrow and thinking what else is going on? What are we not being told? What is behind closed doors that's not being told to us? Because when you look at the information that they're telling us, the data, or what they talk about during different meetings or different press conferences that they have, it makes no sense, it doesn't add up, and it's all, why would you say that? What's your reasoning behind that? And there's nothing that they are saying that makes 100% sense, but we're sitting there accepting it, and that blows my mind. Now, I understand that people are going to say that you can't compare a state like South Dakota or Tennessee to New York because there's different demographics, different populations, different issues that arose from this virus, and that each individual state has to deal with this virus independently from one another. And I totally agree with you on that. But let's look at a state like Florida, for instance. Florida has over 20 million residents that live in that state. Of the residents that live in that state, about 19 to 20% of those residents are ages 65 and older, or they're senior citizens. And Florida has the highest population of senior citizens living in one given state. Now, some of those senior citizens move to that state for medical reasons. Like, let's say they got arthritis, and in the wintertime, their arthritis flares up and they have stiffer joints and bones and muscles, and it's harder for them to get around. So they move away from that area that they lived in that has winter weather, and they move to Florida for the all year round summer warm weather. Maybe some people move there to retire because they don't want to bother with the winter weather and all the issues and problems that arise from that. So they move to Florida and retire there. And a good majority of them were born and raised in Florida. Now, also, Florida has a high number of tourists and vacationers that go to that state because there's a lot of positive things that draw people into that state with all the amenities, attractions, Disneyland, sporting events, beaches, and a lot of different things that make people interested and wanting to vacation there. Now, with the demographic and makeup of a state like that, you would think that the COVID deaths are high as can be and the positive cases are out the wazoo. And when you look at the numbers, as I'm making this video right now, there is less than 3,000 people who have died from this virus, and less than 55,000 people who have tested positive for this virus. Numbers that are astonishing, numbers that are unthinkable, with the highest number of senior citizens who are the most susceptible from this virus to die from. They have less than 3,000 dead. Yet you look at states like Pennsylvania and New York, for instance, they have over 2,000 deaths in senior citizens alone, almost the same amount of deaths that Florida has in the whole entire state. Pennsylvania and New York have in senior citizens alone. And they were told in New York and Pennsylvania that nursing homes and long-term health facilities had to take in COVID-19 patients, and they had to take in patients that might not have been told to these facilities were COVID-19 patients into their facilities and take care of them. Yet the governors knew, because the healthcare officials told citizens like me all across this country to quarantine and distance myself away from people living in nursing homes, long-term health facilities, people with weaker immune systems or underlying health conditions, to stay away from them. But why are these governors like Tom Wolf of Pennsylvania and Cuomo of New York telling senior citizens that you got to be next to COVID-19 patients, or that you have to accept these patients into these facilities? And yet healthcare officials are not questioning them or telling them no or going after them. They're just accepting it and allowing this to happen. Are they getting paid off? Is there more that we aren't being told by these healthcare officials? Do they have some agenda and they're working with these governors and we don't know about it? Are there things that they're hiding from us? We don't know, because we're not questioning. We're not demanding answers. We're not making them give us certain answers and making them have to tell us certain things. We're just accepting what's happening and saying it is what it is because it's the virus. It's something new and different that we haven't experienced before in American history, and we just got to let it go and move on. That's all that we are doing, but we're not trying to fix the problems that we can fix. We're just allowing it to happen, and we're not angry and going after the people that should be getting questioned and in trouble for allowing these certain things to happen that shouldn't have happened before. Now, if you want me to believe that these governors did a good thing, or things didn't work out as planned and things were all right and this was a good idea in some facet, then why did Dr. Levin, the healthcare leader of Pennsylvania, take her 95-year-old mother out of a nursing home and put her in a hotel? If she thought that this idea was so great and she didn't fear for her mother's life, why didn't she leave her in a nursing home? Tell me that. No one will answer those questions. She won't answer those questions. But we're not praising the governor of Florida. We're not high-fiving him and interviewing him and doing Google Hangouts or Zoom meetings. We're not doing anything mass media-wise to give this guy the proper praise and congratulations that he deserves. No, we're giving those praises to Tom Wolf or Cuomo or Phil Murphy or some of these other Democratic governors who have done a horrible job and have killed thousands of people from their dumb, idiotic ideas and plans that they put in place. And if you want me to believe that these governors really, really care about the citizens of their state, then why is Tom Wolf going against his own orders that he put into place that said you can't be in groups bigger than 10, and he's out there protesting with Black Lives Matter in his state, and he's taking pictures with them, and he's going against his orders? How can I then believe that his orders are great for this state and make sense for this state if he's going right against them? And when the healthcare official lady, Dr. Levin, is getting questioned on one of the press conferences she had, she can't give good reasons why it's all right that Governor Wolf was there next to hundreds of people and not social distancing or quarantining, that he's doing press to make the Democrats look like we care more about Black Lives Matter and social justice than Republicans do, to prop up the party, to make the party look good, to make the party more favorable with the Black Lives Matter and the social justice groups, to want to back them and not the Republicans. She can't give a good answer why. Oh, we don't think that protesting is bad if it's done in a safe and healthy way. How is being next to 500 people, 1,000 people, a healthy way, according to healthcare officials, according to Governor Tom Wolf, a healthy way, but he's right next to them, and it's all right for him to be next to thousands of people, but I can't open up my business. Tell me, how does that make any sense? And why are we praising him like he's the best thing since sliced bread, or praising Cuomo for going after Donald Trump, harassing Donald Trump, and being a thorn in Donald Trump's heel? Yet you look at his state that has the most amount of deaths and the most amount of positive cases and makes up about 1/3 of the whole entire state's deaths and positive cases. Now, it's not just me who is going against these governors, going against the healthcare officials. There's other people out there who are protesting them. There's other people that are out there screaming and yelling because they can't get back to work and their business is crumbling, that the money that they're getting in unemployment is not enough. That when you listen to them talk, when you listen to them preach, these healthcare officials or these people in the mass media, they degrade us. They call me names. They say things to make people like me look like we're so terrible, heinous, idiotic, dumbo, stupid. They brainwash people not to want to believe anything that I'm saying or take anything that I'm saying as being correct or being any knowledgeable, or I'm looking too far into this, or I'm a conspiratheist type of person. They say to the protesters that these are just dumb Trump tards who are being wrongly influenced by Donald Trump to protest these governors because they're making them look bad and they're killing his economy. And these are just a small portion of the state's population, that we should not take them seriously, that these people don't make up the mindset and thinking of the state, or that people that are protesting are not social distancing, quarantining. So if they should get the virus, they should be ridden of any health care rights they have, and that they should be denied any medical care because they are not doing what the CDC and healthcare officials told them to do to keep people safe. Now, we went into these lockdowns and quarantining and social distancing because we wanted to do a couple of things. We wanted to stop the curve, stop the spread, and make sure that people that have low immune systems, underlying health conditions, don't get this virus and die. Now, if you look at all across this country, we have stopped the curve. Yeah, there's a couple influxes here and there that are going to happen when you open up states because more people are out. There might be more testing available at that one time. People are going to be around each other a little bit more. So yeah, there's going to be times where the cases go up and then down and then up and then down. It's going to happen like any virus. At any time that viruses become more prominent at different times of the year, it is going to happen. But you don't see hospitals overrun and have too many COVID-19 patients where they're begging healthcare officials, governors, or the federal government for more PPE equipment, ventilators, beds. You don't see that happening. What you actually see is because governors and different healthcare officials told hospitals that you can't have elective surgeries, or certain people who don't have life-threatening issues go to your hospital to seek medical care or to get surgery. We can only keep hospitals available for people that have life-threatening issues or have COVID-19. Hospitals have actually been laying off employees because they can't warrant having all these employees employed and having no business to support them being there. An industry and a business you would never think in your wildest dreams would ever lay off anybody, are laying off employees left and right. Now, it's not just me and we openers, as I'll call us, that are complaining about this and hooting and hollering about things that are going on that don't make sense and complaining about governors and healthcare officials. There are doctors and physicians all across this country who have been coming out here and there complaining about what the governors and healthcare officials are saying, not agreeing with what the agenda that's being said by the mass media, and they're actually getting harassed, called names. Some of them are saying that you need to die, that you don't know what you're talking about, that you're a fraud physician or doctor, that you have no idea what you're doing, that you don't have an understanding of what's really going on, that you have some agenda, or that you're backed by certain people and you're just saying this because you're getting paid off, and so many different things. And yet a lot of these physicians and doctors are not trying to get publicity. They're not trying to get notoriety to build their name up higher or trying to get their business booming, so they're making these claims or saying these different things. In the contrary, they're actually coming out knowing that they're getting criticized and potentially harassed and maybe death threats, and saying that what we are being told by these physicians, healthcare doctors and healthcare leaders and certain people in the government don't make sense and don't add up, and more issues and problems are on the rise that we are not being told about about or being expelled about. So for instance, we have over 25 million people who are on unemployment, the highest numbers that we have ever seen since the Great Depression. Now, if you listen to what some governors preach, why they won't open up the state, why they won't allow people to get back to work. Like, for instance, Cuomo of New York. One of the times when he was doing a press conference to update people on what's going on in the state, their plans, the action, the COVID problem, he was asked by a reporter that people have been protesting all across your state, begging for you to open up, allowing those citizens to get back to work, allowing those people to get their business back open because the money that they're making in unemployment is not enough. Even with the additional $400, $600, $800 on top of their unemployment, it's still not enough to pay for all the needs that they need for their family or themselves. And you know what the governor of New York said? He said that I got to worry about deaths. I got to make sure that people don't die. Death, death, death. That's what he preached, was death. Consistently death, death, death. But yet you sat there in the beginning of all this pandemic issue, complained, argued, screamed, and yelled to Donald Trump that you're a piece of crap, that you're not helping me, that you're not doing this, you're not doing that to support me, that you got an agenda, that you're doing this, that you're doing press conferences to make yourself out there in the public, and all these different things. Instead of looking at a state crumbling, state of disaster that's happening in New York, having the most amount of deaths and the most amount of positive cases, and now the whole entire country is in New York, and this is the biggest vocal Democratic hater of Donald Trump during this whole pandemic. This guy has the worst state in the whole entire country. Now, doesn't that seem to add up to something not making sense? Doesn't that seem to equate to something that we're not being told? If you're complaining and being the biggest nag to Donald Trump and your state is in the worst state of affair from this virus, things don't seem to make sense. In my book, I don't know about yours, but in my book, doesn't seem to make sense. Or when you look at Tom Wolfe, when he talks about businesses opening up again and people getting off of unemployment, when he's doing another press conference, he was talking to a reporter just like Cuomo. They asked him that you're going through your phase plan from red, yellow, green, that you are going into yellow phase in certain areas of the state, and certain businesses are starting to open up. And these businesses have said that they are having a hard time getting their employees to come back from unemployment, that they are making more money on unemployment than they were working prior to being on unemployment. And you know what the governor of Pennsylvania said? He said, just pay them more. Just give them more money. Now, that is not a shocking statement, but a stupid, idiotic, dumb statement. If you are a governor and a businessman, that is a dumb statement. Now, if you look at politicians who are Democrats who have been campaigning all across this country, they have been preaching raising the minimum wage, raising the minimum wage, because they feel that the minimum wage was enacted years ago and it doesn't represent the price of living that is needed now in order to survive, that the minimum wage was set too low for the time that we're in now, that we need to raise it so people can be able to work at X job and be able to survive with the money that they're making. They're making $8 an hour is not enough to survive on. Well, if you look at what Tom Wolfe said, he said that employees need to be paid more to warrant them to come off of unemployment. Now, if you haven't worked, if you haven't made any money in your business, and your business has made $0, how can you warrant a company or a business, regardless of how it is being run, either corporate ran or independently ran, pay for these employees to make more money when you can probably not pay for what you need to pay because you haven't made any money, or not be able to pay for the employees to even be there when you haven't made any money? The idiocracy in that answer was just a Democratic agenda answer that nobody really looks into or thinks about. It's a stupid business answer that makes absolutely no sense. And if you look at the Congress in Washington, all the Democrats continue to try to push more stimulus checks, and more unemployment, because they don't want people to come off unemployment. They want to continue to give out these stimulus checks and these unemployment, full pay, an extra $600, $800, $900 in your unemployment, because they want to keep people on unemployment, to crash the economy, to make the economy go down the toilet. So Donald Trump looks bad, and he looks so inept that you crippled the economy that was doing fine because you didn't act quick enough during this virus. Your inept action killed this country's economy. And if we had somebody like Hillary Clinton or Joe Biden in office, this wouldn't have gotten to this point, and things would have been a lot different. That's what they are trying to do in Washington when they continue to try to push these stimuluses, and the Republicans keep on denying it because they know that jobs are coming back, that the economy is getting better, that over 2 million jobs in the last month came back all across this country, that continue to allow people to make all the money that they used to make in their job, and giving them extra money in their pay makes no sense right now, because they're using business mind thinking and not using agenda thinking or propaganda thinking or Donald Trump hate thinking when they make these decisions. Now, it's not just people like me who are criticizing or yelling about not opening up the economy and making it better. Like I said, you got doctors and physicians complaining about this and saying that other than the economy issues, you have issues with mental health problems like anxiety or depression, or you got physical problems like suicide, drug use, or you got problems with people getting raped or have domestic violence problems. These are on the rise and are raising because people can't handle everything that's going on. They can't handle the way that the country is being ran, and that they can't get back to work. They can't go out to eat, and they're stuck with this person that they might not get along with, or they just can't handle everything that's going on, and they're doing things that are on the rise that are going to take years and years to fix. Other than the economy and making money and any of that, mental, physical health problems are going to take years to fix, and maybe never be fixed by some people. And on top of everything, these healthcare officials have said that we try to run our practice. We try to do things to try to treat patients and take care of our patients who come to us to look for help because they're sick, either with COVID-19 or other issues that could be related to COVID-19. And they are told, you can't go to see physicians and doctors. You have to do Zoom meetings. You have to do virtual meetings. And healthcare doctors and physicians are saying, I can't do proper diagnosis. I can't do proper Zoom physicals unless the person's in front of me, unless I can feel, touch, hear, talk, and all these different things that a physical involves. If I can't do that in person, then doing Zoom physicals makes no sense and doesn't help fix anything. Yeah, I can somewhat try to treat a patient over the phone, but I can do a better job if they're in front of me. But I'm told I can't see people, or certain people I can see, because the CDC and the healthcare officials of the state dictate how I run my business. Or I'm not allowed to prescribe certain drugs because they're not FDA regulated, even though I've been told by the President of the United States that hydrochloroquine is a drug that's been out for over 50, 60, 70 years, that was invented to treat malaria, can be used as a drug to help the recovery process, not cure, not prevent, but help recovery process of COVID-19. I am not allowed to prescribe that. And when I try to prescribe it, different pharmacies deny the drug to different patients and tell them that, why are you prescribing them? What's your reason behind that? Because the FDA has not said that this drug is a drug that is proper usage for COVID. They try to deny that because they don't want Donald Trump to possibly maybe look like he might have found something to make him look more popular, to make him look better. That the FDA wants to be the ones to say, yes, we agree with Donald Trump. Without FDA saying, yes, we don't agree with it. But healthcare officials like physicians and doctors are saying that we can't do our job properly. Now, if you look at a corporate company, for instance, when the corporate office makes decisions, almost all the time, when it trickles down to the store level, people that work with the patients, people that work with the customers, people that do the everyday job that makes the company money, you know just as much as I do that they 99% of the time don't make sense. We don't understand where they came up with that idea. How do they think that that benefits the employees or benefits the customers? That makes no sense in any direction. That is the same thing that these healthcare workers, that are physicians and doctors, have to deal with. The healthcare officials of the state, the CDC, makes these decisions, and it trickles down to the physicians and doctors, and they say, whoa, why are you making this decision? It's not helping me treat customers or patients with this virus. It's not helping me get my business running correctly. It's actually making my business have to work harder, have to do my job and make it more difficult. Instead of allowing me to do the job that I've been doing for 15, 20 years, perfectly fine. There was no issue the way I was doing it. Have to change everything because a corporate guy or a CDC or a healthcare leader tells me I got to do things different. Yet I've been doing the same thing for the past 15, 20 years and it's been working totally fine. That's the same thing that is going on in the state and in this country to healthcare professionals all across this country. So you want me to believe the CDC and healthcare leaders of the state when physicians and doctors are coming out saying that my business, my practice is being destructed and being crippled because of these decisions and I can't treat people properly. To me, I believe that there's more of an agenda. There is more that is being hidden from us and more that they're trying to do, regulate and control that they don't want us to know about and be told to us, and we are being blinded by it because we're getting suckered into the hysteria, being suckered into the whole mass media preaching on a daily basis that we need to turn off the television, stop listening to people, give the finger to the man and tell them that we're sick and tired of how you're treating us, sick and tired of how you're controlling our lives and telling us how to live, because that's why people move to America, to get away from dictatorship governments and be able to live your life free, preach the religion that you want and do what you want as long as you don't hurt, harm, or affect anybody else. Yet that's what these governors and healthcare officials are doing, is controlling us and telling us how to live our life, what we can and can't do on a daily basis, and run our lives like we need them to tell us what to do and not to do. We need to, as I said, give the finger to the man, open up our businesses, live our life, and tell the professionals who are working on a daily basis, do the job the way you feel fit that you need to do to keep us as American citizens safe. Screw the CDC and healthcare officials of the state. Do what you need to do and give the finger to the man as I've been preaching, and do it your way and open up your business and tell them that we've had enough and get back to normalcy, because that's the only way we're going to stop what's going on, stop this virus from spreading, and stop everything that's going on, because it's getting out of hand and getting out of control, and we need to go back to the way things were and stop these hellacious Democratic governors who are doing all this negative stuff.